So I'm Andrea Janoyan, nurse practitioner and doctoral student, obviously. I'll be presenting my project today on vaccination hesitancy among healthcare workers. I'd like to thank Dr. Jackson and Dr. Frank for their support during this project, and also my family. I'll start with the background of the problem. Yearly, over 1.5 million people die due to vaccine preventable disease worldwide. These figures are, of course, at risk of increasing if not addressed proactively. And vaccinations are known to reduce morbidity and mortality, preserve limited healthcare resources, reduce healthcare disparities among racial and ethnic groups, and provide health promotion. In the background, continued reasons for failure to vaccinate among healthcare workers include concern over safety of ingredients, religious or philosophical objections, fear of associated illness, lack of urgency, and a false sense that herd immunity will provide protection. Most full-time nursing faculty, 60%, intended to receive the COVID-19 vaccine, and only 45% of adjunct nursing faculty and students reported intent to vaccinate, according to a study by Manning in 2021. And some of the reasons included were concern over the vaccine safety and side effects. A low level of knowledge related to vaccine development is also identified in this study, and the data does indicate a critical need for increased vaccination rates among healthcare workers, especially among nurses. The problem, there is a need for a formal educational program focused on motivating RNs to obtain their vaccinations, and healthcare workers are an important target group for vaccinations. Even though such evidence has been well documented in literature, vaccination rates are still suboptimal, and deficiencies in vaccinations are risky for not only the healthcare workers, but patients and the community as a whole. With the new vaccination recommendations, including the updated COVID-19 vaccination recommendations, the time has definitely come to focus on evidence-based strategies and recommendations to protect healthcare workers and their patients. The purpose of the project is to improve knowledge, vaccination hesitancy, and confidence among RNs and healthcare workers. Which leads me to the PICO question. Among Tennessee nurses who hold membership in the Tennessee Nurses Association and/or Sigma Theta Tau, how does implementation of an evidence-based virtual education program on recommended vaccinations for healthcare workers affect intent to vaccinate, vaccine knowledge, confidence, and hesitancy over 6 months? This leads me to literature search. I conducted the search primarily using CINAHL and PubMed. The search terms I utilized were healthcare workers, nurses, influenza vaccine, COVID-19 vaccine, immunization recommendations for nurses and healthcare workers, and vaccine hesitancy among healthcare workers. I conducted a theory search utilizing Pender's health promotion model and health belief model. And the parameters included English language and publication dates between 2017 and 2021. Publications prior to 2015 were considered hallmark studies. The types of studies were systematic reviews, randomized, controlled, non-randomized, observational, and quantitative, qualitative, and peer-reviewed best practice recommendations. Other parameters included within and outside of the US and focused on adults and healthcare workers. Of course, the literature search is ongoing. The PRISMA model you can see here, I started with 47 articles and reduced initially to 40 and narrowed it down to 11, eventually limiting to 7, which were included in my literature review. The impact of the project will include possible conferences, practice updates, publications, online CEU opportunities, The articles that I did focus on, I chose 5 here that were influential for the project. The SAGE working group, SAGE is a working group developed by the World Health Organization to work on vaccinations. That was a critical article. And the next one is the Chorus article focusing on the health belief model. And the Lamorte article also focused on the health belief model related to vaccinations. And the World Health Organization, together we can close the immunization gap. And then the CDC recommended vaccinations for healthcare workers. Gaps in the literature. Currently, few strategies exist that address vaccine hesitancy among healthcare workers. There is a lack of inclusion of COVID-19 vaccination in the literature, and few strategies exist that have quantified the impact of a hesitancy hesitancy prevention intervention. And there are a disproportionate number of studies being conducted abroad versus here in the US. And this is my logic model. I'll take the listed resources and apply these resources to reduce the vaccine hesitancy project with the expected short-term outcomes of 100 nurses participating in the project, 75% increase in nurses' vaccine knowledge and intent to vaccinate and confidence, and 25% decrease in vaccine hesitancy after the educational intervention. Long-term outcomes are 85% increase in knowledge, intent to vaccinate and confidence, and a 50% decrease in vaccine hesitancy after completion of the educational intervention. And the impact will be vaccine hesitancy is improved among healthcare workers. And project will be sustained by creating best practice environment. The project environment will be conducted via the Sigma Theta Tau and the Tennessee Nurses Association websites, where they have online forums for posting surveys. And there will be a pre-test and post-test survey and educational intervention that will be posted on the online forums for both sites. For project implementation, as I mentioned, the design is based on a pre-test and post-test model that will be incorporating vaccine hesitancy. And vaccine hesitancy will be assessed using the SAGE Working Group Vaccine Hesitancy Survey, or VHS. And I have modified the VHS by implementing 7 items of the VHS to measure a 5-point Likert type rating scale from strongly disagree to strongly agree. It was originally 10 items and it's now 7. And the data analysis, as I mentioned, will compare pre-test and post-test. And results of the pre-test and post-test will be compared to determine the knowledge of vaccine recommendations for healthcare workers, as well as intent to vaccinate. And differences in the pre-test and post-test scores will be analyzed using paired samples, dependent samples t-test to determine statistical significance. I conducted a SWOT analysis and found the following strengths. The benefits of vaccination far outweigh the risk. Vaccines are widely available with minimal or reduced cost. And the CDC is linked to a network of local and state immunization programs that can support this plan. And the media is interested in this issue. Opportunity, protect healthcare workers and patients from illness and death. Take a nursing leadership position in advocating for disease prevention through vaccinations. Build awareness about the detrimental impact of anti-vaccine movements, and develop media literacy among providers and patients. Some of the negative or weaknesses: offering a nursing education credit was cost prohibitive, but healthcare workers can still participate. Individual rights outweigh societal needs, and there can be mistrust of government. Threat: some social media posters resort to incomplete references, misquotes, and distortion to promote their positions, and vaccine safety could become a foundation for some anti-government movements. This is my project timeline. We're currently, of course, in November, and IRB approval is pending. Qualifying exam is in progress. December, plans to distribute applications for mentoring program and email my contacts within TNA and Sigma Theta Tau, plans for survey forum. And January, check in with the program chair and complete the survey and finishing touches. February through April, open the initial online survey. May, open follow-up survey post-test, and close the initial online survey. And June and July, begin the data analysis. And the theoretical framework for the project is the health belief model. And you can see it incorporates the individual perceptions, perceived susceptibility of seriousness of disease. Modifying factors include age, sex, ethnicity, personality, socioeconomics, knowledge, perceived threat of disease, and cues to action, media information, education. And likelihood, this will lead to likelihood of action, perceived benefits versus barriers of behavioral change, and likelihood of behavioral change. There are 6 constructs to the health belief model: perceived susceptibility, perceived severity, perceived benefits, perceived barriers, cue to action, and self-efficacy. It aligns with the goals of the translational project related to vaccinations, and it's often used as a framework for other surveys and studies related to vaccinations and preventative health services. In conclusion, vaccinations are a health behavior that aim to improve outcomes for healthcare workers, patients, and the community. Now more than ever, as nurses and healthcare workers, we need to exemplify the health promoting behavior by educating and receiving recommended vaccinations. And please see my reference list here. And I thank you for your time and attention. I'll go ahead and open it up for any questions or comments.
Thank you, Andrea. We'll open it up for your committee.
Thank you.
Thank you, Andrea. Great presentation. I will open it up to our own Dr. Karen Frank, who is Andrea's committee person. Dr. Frank.
Hello, everybody. Yes, great presentation, and working in healthcare in the hospital in this time, everything you presented is spot on. Looking forward to seeing what the outcome is going to be.
Me too. I'm hopeful for good participation online and between the 2 forums. Hopefully that will allow for more participants and a greater end number. We'll hope for that.
We did suspect there might be some bias in Andrea's project because those folks who join professional organizations, theoretically, we hope that they're at a more engaged, more knowledgeable level. But I think the literature does not particularly show that. And so it's going to be very interesting, the results that we get. Nurses know what is good for patients. They advocate for preventive health, but sometimes they don't apply it to their own selves. So I think Andrea's project is very worthwhile, and it will bring some great insight into healthcare workers' thinking.
Thank you. I appreciate those comments.
Andrea, I just have a question about your data collection. You're doing a pre and post design. Will you have some qualitative data as well to try to ascertain why there's hesitancy on those unvaccinated?
Part of that's incorporated in the vaccine hesitancy scale. It does address their perceptions to vaccines and some of their beliefs related to that. So there will be an element of that in addition to the quantitative as well. I should have shown you my actual VHS that I've adapted. That would have been helpful to see, but I can show that later in the breakout room if needed.
Okay, thank you so much.
Thank you.
Andrea, I'm curious, are you, when you're recruiting your participants, you're taking all comers, or are you going to try to only focus on those who have been hesitant towards getting a particular vaccine, or do you have any thoughts on that?
I'm planning to open it to all who are wishing to participate and not limiting it to people who are vaccine hesitant, so that I'm hopeful to get a true representation of all the nurses through TNA and Sigma Theta Tau, at least even though it may be slightly biased, at least those that are participating, I would open it to all that are available to do that or interested. There's no incentive to participate, which I had thought about initially, but decided to drop that piece of it.
Yeah, I was just thinking if you were wanting to look specifically at maybe why people are vaccine hesitant, or why nurses are vaccine hesitant, that you might have a much smaller subsample, right, of people who do identify that way. Are you going to ask them specific questions about if they have opted to wait on certain vaccines, or is that part of your questions at all?
That isn't one of the specific questions, but that may be one of the demographic questions I'll add leading up to the survey. That's a good idea that I might want to incorporate that.
Yeah, I think it would be interesting just to say, if you have children, have you gone on a modified vaccine schedule? Or if you have a child of age, have they received the HPV vaccine? Things like that could kind of give you a fuller picture of their position on it would be kind of interesting.
That's a good point. Thank you.
So,
Do we have any other questions or feedback? Thank you so much, Andrea.
Thank you.
Catherine, would you like